So for invasive needle control, they still use acupuncture needle, puncture the skin at acupuncture or non-acupuncture site, but they may not insert deep enough or as deep as the real acupuncture. They may manipulate the needle differently, and this is to really simulate needle acupuncture. For the dummy needle control, it's non-invasive. You can still use of different types of needle, providing some sensation at the acupuncture point or at non-acupuncture point site. Then you can some studies can also choose non-acupuncture like placebo control, inert intervention. For example, like you may use deactivated electrical stimulation. You show the stimulator, but you are not activating it, and so on. Laser acupuncture, so there's no real penetration. Okay, with that in mind, let me bring you through 3 studies. Firstly, I think one published in Lancet Neurology. This is a neurological journal. They look at the efficacy of acupuncture for prophylaxis of migraine. It's a multi-center randomized controlled clinical trial done in Germany. Okay, they want to assess 3 group of patients. One group has standardized, real or part standardized, but real acupuncture in accordance with the rules of TCM. I think that is important because if you don't use TCM concept into the research, you probably will not get the result that you want. Then you have the part standardized sham acupuncture, and they have the standard migraine prophylactic group using either beta blocker, calcium channel blocker, and so on. So prospective randomized over a period of 13 months. Patient must have 2 or 6 migraine attacks per month to get included into the study, into 3 groups. So for these particular studies, 10 sessions over a period of 6 weeks. But if you look at another study, it may be 8 weeks. So that's why it's very difficult to standardize acupuncture research. Why do you choose these points? Why do you use 8 weeks, 10 weeks, or why not 12 weeks, and so on? Okay, primary outcome, difference in migraine days between 4 weeks before randomization, and after that, you reassess them 23 to 26 weeks later. So more than 1,000 patients screened, 960 randomized into the treatment group. Immediately after randomization, 125 patients straight away withdraw. In fact, 106 of them actually randomized into standard group. So this is one of the problems that we face when we do acupuncture research. Some patients agree to be randomized because they want to receive real acupuncture. But the standardized group, since they get randomized to that, I don't want to take part. Because they want to be part of it. So therefore, maybe the placebo effect is already there. But anyway, this is how things happen. Okay, what happened is that the mean reduction is 1.5 to 2.3 days. So these differences were statistically significant compared with the baseline, but not across the treatment groups. So in other words, there's no difference. This is not an inferiority study. It means that you are not doing the study to say that this is inferior to what. It's actually comparing 3 groups, and within the groups, they compare with before and after treatment. So the conclusion or the interpretation of that study is that treatment outcome for migraine do not differ between patients treated with sham acupuncture, real acupuncture, or standard therapy. So you can always say that, you can always argue that, yes, acupuncture is equally effective as compared to standardized treatment and better than when you are not receiving the treatment. That's one way of interpreting it, the data. And this is another group in Germany, published in JAMA a little bit earlier. And also 2 groups, 2 acupuncture group and wait list. Means you wait, then you subject them to acupuncture later. And I'm not going to do the details of the data, but at least they diagnose migraine based on IHS criteria. You have a group first, then you subject them to acupuncture treatment. So this is to be delivered by specialist physician trained in acupuncture, 12 sessions per patient over 8 weeks. Okay, I don't want to go to the details. You can go to the PubMed to find the data. Conclusion is acupuncture was no more effective than sham acupuncture in reducing migraine headaches, although both interventions were more effective than wait list control. So in a way, it does say that acupuncture may work. Okay, this is the latest data that hasn't been published yet. This is under the online early articles, which I got it a few days ago, supposed to come out in the Headache Journal. And this study was conducted in Italy. Okay, prospective randomized, 160 patients. They first diagnosed the patient with using IHS criteria. then separate them into 4 groups. The true acupuncture group. So the moment you have diagnosed them, so this 160 patient, maybe 40 patient, you send them to TCM physician, they diagnose the patient using the TCM criteria and standardize the treatment according to the TCM criteria. So they have the true acupuncture group and they have the mock acupuncture group. All of them has symptomatic treatment using one of the triptan, except the last group without any prophylactic treatment except receiving symptomatic treatment. The conclusion of that study was that only true acupuncture group have good outcome compared to the use of symptomatic treatment. The mock acupuncture group showed transient improvement but not persistent. So in other words, I think this is one of the good study to say that true acupuncture probably works as compared to sham acupuncture. The summary of all the studies published in the last 4 or 5 years, I think is actually being summarized by this author in the expert review in neurotherapeutics. So basically what he says is that since the last Cochrane review of acupuncture headache in 2001, which found methodological and or reporting shortcoming in the majority of the studies, several large randomized trials on effectiveness of acupuncture as treatment for headache have been published. So basically what they found is 6 weeks course of acupuncture is not inferior to a 6-month prophylactic drug treatment. You have heard all the side effects of different types of prophylactic treatment. As long as you are taking Western medicine is foreign to the body, you're sure to have good effect as well as side effect. If the patient are not tolerable to Western treatment or because of severe allergic reaction and so on, and they're still disabled, I think it's worth considering a trial of acupuncture. And you heard about there's no difference between real or sham acupuncture until the last study. So they felt that specific Chinese point selection, the way they stimulate the point, how deep you stimulate and so on, may not be as important as it has been taught previously. So they thought that acupuncture should be considered or should be incorporated into the existing migraine therapy protocol. But our practice guideline group felt that such recommendation we should be more conservative in recommending acupuncture. Therefore, in your guideline, you see the word maybe, even though we have good evidence. For my last slides, I just want to point out that acupuncture needle is something invasive. It will puncture your skin, therefore it can potentially cause damage. So just remember, make sure that patient doesn't have platelet disorder, is not on anticoagulation or any form of bleeding tendency. Because puncturing the skin, maybe no big deal. But if you puncture a blood vessel and when you take it out, you don't press long enough, you start to ooze, I think it may potentially give problem. There are many acupuncture points that can be used to induce labor or shorten the labor duration. So if you stimulate those points, the patient will have premature labor. So never use acupuncture for pregnant women. Find out whether the patient has cardiac pacemaker and so on. So just remember, giving acupuncture is a skill. So you need to be trained and you need to practice. So I'm sure that some of the, you may be sitting here, might have gone through or is undergoing some form of acupuncture treatment. Yes, it's important to know the knowledge part, but practice also counts. Important thing is, if you're not sure, don't do it. Send it to someone that has experience in giving acupuncture treatment. They may not have the same concept as you, but at least you make the diagnosis of migraine or tension headache using the Western criteria. You have excluded all the secondary causes of headache. You have tried all sorts of medicine, and you feel that this acupuncturist is safe enough, maybe a trial of acupuncture should be considered in someone that is disabled by frequent headaches. Thank you very much for your attention.